Well, the Perfectum Foundation was founded in 2011 by Kong Do, the parent of a child with autism, supported by other parents and professionals who undertook this mission. Our mission is to be on the forefront of creating new leadership, networking, advancing interventions, and offering the state-of-the-art training opportunities. We're dedicated to advancing development in all children, in adolescents and adults, with autism and with other special needs. And at Profectum, we are launching this long-term perspective. Well, there really is a need for the work that we're doing. With the increasing number of children on the spectrum and other special needs, we have a lot to do. We need to be better at early identification. We have to start early intervention sooner. It matters. We have to help parents figure out what are the best approaches that would work for their children. And we have to think about our children growing up and prepare them for the future, for meaningful occupations, for relationships, for a meaningful life. And we don't have enough people to do that. So Perfectum is dedicated to meeting the scarcity of well-trained professional and resources and embracing parents to help us do this job. So what are the needs? There always has to be a need. A need is what drives us. We have to advance our knowledge, what works best for whom and when. We have to be flexible in the way we intervene. We have to integrate the best of all disciplines and complementary treatment methods in a collaborative fashion. We've created a series of best practice guidelines which can bring in all the different approaches that will fit that child. And the big umbrella that we're now using are the foundational capacities for development. And this will be the vehicle that embraces DIRs at the heart and adding components that we have since learned that will be important. So our goal is working for the individual, fitting them not into a program, but finding the program that fits them. The big goals of the Academy: we want to create a large interdisciplinary network of clinicians, educators, paraprofessionals, parents, and we want to provide them with accessible and affordable web-based training options in addition to regional and national conferences and workshops. We hope to provide this training in many, many different forms, and one of the major hopes we have is that we could provide the kind of training that will ensure better outcomes that we could use for research. Our faculty is really quite remarkable. We have 52 interdisciplinary clinicians and educators who have joined the Perfectum Academy, and almost all of them have worked together for many, many years at the DIR Institute. And who are we? We are who you are. We are educators and speech and language therapists and OTs and PTs and mental health professionals. We come from the fields of medicine and developmental optometry and the creative arts and others who are dedicated to the mission of working with our children. Our faculty that you will be meeting in this part one, are, as well as some guest experts, all participate in working groups to develop the vision, the values, and the goals, as well as the credentialing criteria and the curriculum that we will be using across all our training models. So we are a work in progress. We still meet every month, looking and discussing the right approaches, figuring out the exceptions, thinking for what else we need to learn. And this wonderful group will be providing the lectures, we'll be running our discussion groups, our tutoring groups, and mentoring that are required to obtain the certificate. This first course will be a course organized around 4 units, and that can be completed in 1 year. Now, what do we need it for? We want everyone to be the most competent professional they can be in order to practice DIR assessment and intervention. Our goal is to change the way professionals work. We want professionals to be integrated professionals. You all get trained in your own discipline. How does it all come together? And how do you learn to integrate families in the way you work? We embrace mental health principles. We know that this is important not just for the child, but for the parents, the family, and for ourselves. And therefore we engage in reflective practice. We think about what we're doing. We think about how it makes us feel. We think about our relationships with the people we work with and how to do the best we can.